Give us your take right now on where this viral epidemic stands.
Well, we continue to see a steep climb in cases every day. Those are the reported cases. It's not necessarily the days that the cases occurred. But with this continued increase, despite very aggressive measures being taken in China and now outside of China, I mean, I think we really have to ask the question, is it going to be possible to contain this virus, or is this going to be something that circulates similar to, a pandemic influenza?
Well, let's talk about that, Doctor, because obviously for those of us particularly who are not doctors and don't know the science, we can overreact. I suppose we can underreact as well. One of the things I heard today was actually the lethality rate, the mortality rate for coronavirus right now roughly tracks that of the Spanish influenza back in the early part of the 20th century. Now, obviously, that was a very different situation. It was much more broadly based around the world. But is that true?
Yeah, so if you just took the number of cases and the number of deaths and you divided the deaths into the cases, you would get that 2%. But it's not really an accurate way to look at lethality, because it's possible that there are many, many more cases out there that we're just not counting, particularly mild cases. So my best guess is that the mortality is actually lower and perhaps much lower than that 2%. When I brought up the pandemic influenza, I just want to say that when we talk about pandemics, we do so with respect to geography. So meaning that the virus is capable of spreading around the globe, and that's not necessarily an indication of its severity. I know the word pandemic can sound scary, but really when we talk about it in the epidemiologic sense, it's about how quickly it's spreading and where it's spreading.
So from your point of view, are the authorities both in China and the United States doing what ought to be done? Are they doing what they can do at this point?
Well, I think that you've seen a lot of aggressive measures being taken, and yet still the virus continues to circulate. And for me, that's not entirely surprising, because respiratory viruses like this do spread very quickly. And I think it's time for us to reconsider what our approach is going to be and examine whether it's going to be possible to fully stop the spread of this. I mean, we also have to consider how disruptive these measures are. You mentioned that the city of Wuhan is going to be measuring everybody's body temperature. I don't even know how they'll be able to act on those data. People have fevers for all sorts of things. I think at some point we have to re-examine our approach. And in my view, I think we're going to have to shift from these very drastic efforts that don't seem to be helping, I think in many ways are probably hurting, and shift to a situation where we're focused on just reducing the spread and protecting those people who are most at risk of becoming severely ill and dying. And although we see the large numbers of deaths being reported, and that's a concern, we also have to examine that the majority of the deaths so far seem to be in people who have some underlying health condition or otherwise known to be at risk for severe complications with an infection, a respiratory viral infection.
We're talking with Dr. Jennifer Nuzzo of Johns Hopkins. Doctor, I've seen some reporting that suggests that the incidence of these epidemics, if not pandemics, is increasing. They're coming up with increasing frequency. We all remember SARS, but we've also had a number of others. Is that true? And if so, what's causing that?
Yes, it is true. There have been some studies that have looked at these emerging infectious disease events, and those are pathogens that we haven't recognized before, and that they go on to cause outbreaks, and then if they're not contained, epidemics. And there does seem to be a clear line that they are increasing. Clearly surveillance for these events has gotten better, but some studies that have looked at this, even when they kind of try to adjust for increases in surveillance, still see that there's an increase. And I think there are a number of important drivers of this. One is that we are a very populous globe, and we are a very connected globe. And so now you can get on a plane and be anywhere in the world in 36 hours, and that wasn't always the case. We're also a globe that is changing our environment in ways that favor the emergence and spread of viruses. So deforestation happening in many countries, allowing people to encounter wildlife populations that they didn't encounter before. Climate is changing and likely moving pathogens into places they hadn't been before. So there are a lot of environmental factors as well that can favor the emergence of these viruses. And when you layer that on top of the fact that we're very interconnected, that there's mass displacement in the world, so people are moving in ways that they haven't moved before, that all creates the condition for not only the emergence of new virus, but the rapid spread of them.
Okay, Doctor, thank you so very much for your patience as well as for your time today. Really appreciate it. That's Dr. Jennifer Nuzzo of Johns Hopkins. And we need to note that the Bloomberg School of Public Health at Johns Hopkins is supported by Michael R. Bloomberg. He is founder of Bloomberg LP and Bloomberg Philanthropies.